o'clock. It's Wednesday, January 14th, 9 o'clock. We're here for the County Commissioners meeting. Would you all call the meeting to order, and would you please join me with the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning. We'll start off with prayer and reflection by Chaplain Gordon Walsh.
Christians, so I pray in Jesus' name, but if there was other faith, feel free to pray along with it. Lord Father, we just come to you on this day. Out here, hear you well. That they in our communities. Amen.
Amen. Adoption of current agenda. Is there any additions or corrections?
There is, Mr. Chairman. Thank you. We need to add one item to consent agenda. Item number 8 would be Resolution 2026-020, the creation of a fund for the Franklin County Juvenile Services. And with that, it would move for adoption of the amended agenda.
We have a motion. Do we have a second?
Second.
Motion and a second. All in favor signify by saying aye.
Aye.
Aye. Public comment. Is there anyone in the room for public comment this morning? Is there anyone on the phone for public comment? No. Okay, hearing none. Approval of consent agenda.
Mr. Chairman, I move for approval of consent agenda items 1 through 8 as presented.
I second.
We have a motion and a second. All in favor signify by saying aye.
Aye.
Aye. Motion passes. Regular business presentation. Overview presentation of solid waste and hazardous waste comprehensive plan presented by Wendy Mifflin, Senior Planner for Herrera Environmental Consultants, Incorporated.
Okay. Wendy, if you can hear me, they are setting you up with the presentation slides up on our screen. Meanwhile, I'll go ahead and introduce her. Wendy is Senior Planner for the Herrera Environmental Consultants. They are the company that we hired to go over the solid waste plan. It hasn't been done since 2010, so we're bringing it current with all regulations and codes and such that have changed since that time. Wendy has 35 years of solid waste experience, and she actually was the Yakima County Solid Waste Division Manager for 15 years also. So a lot of experience there. And she's assisted with the solid waste plans for Thurston, Lewis, Klickitat, Douglas, and Adams County with their solid waste management plan also. Excuse me. So you've all been given the solid waste plan. This is pretty much a high overview of what the solid waste plan is about. This is currently with the Department of Ecology. We've heard back from WUTC, the Utilities Commission, with a letter from them. Things look good. And also from the USDA. And they also said that everything looked good. And Wendy will cover that once she can start her presentation. Probably will be April, May of next year before we hear back from Ecology. And they usually take, I believe, and Wendy can correct me, about 120 days is what they have to cover the waste plan. They will come back with comments on any changes they feel we need to make, but Wendy's had a good track record with the solid waste plans she's put together.
Did you say April or May of 27?
Of this year.
This year, okay.
Yeah. Yes, the SWAC approved the solid waste plan December 3rd of this last year, and then we forwarded it immediately to Department of Ecology. They forwarded it to the UTC as well as the Agricultural Department for review. And those two, like I said, those we've already heard back from. Can you see us, Wendy? All right. I'll let you go ahead and move from there.
Good morning, everyone. I have a brief PowerPoint to run you through the solid waste management plan and then wide open for any questions you might have. So let's see if I can bring this up. Can you see my screen?
Yes.
Okay, I'll put you on slideshow. And we're good to go. So this is the brief overview of the solid waste and hazardous waste management plan update process. A little bit on the regulatory background. Regulations require that local governments such as Franklin County have to maintain a current solid waste management plan. And by rule, plans must be reviewed and revised every 5 years. And just so you all know, the last time that Franklin County did an update date to their plan was in 2010. So you've been very lucky that Ecology has let you go 15 years between plan updates, because that's very unusual. The county and the cities of Pasco, Mesa, and Colotis all executed an interlocal agreement so that you could cooperatively prepare a solid waste management plan. And it's not just a solid waste management plan, it's also a hazardous waste management plan as well. And then you all established a solid waste advisory committee. You did that through resolution and appointing members to assist in updating the plan as we worked through the process. And I think I heard Shirley say that gave you a little bit of background that your solid waste management plan is going to go through regulatory review. And Department of Ecology, the Washington State Department of Agriculture, and the Washington Utilities and Transportation Commission are all going to review and comment on the plan. And on top of that, the plan is required to go through a SEPA process, which I think is complete on your end. We entered the regulatory review period in December, so we're moving through that process already. And then adoption of the plan is done by each of the cities by resolution. They do it first, then Franklin County will do it by resolution, and then it goes back to the Department of Ecology for final approval. So here's a little bit of how the solid waste management plan development process works in Washington State. So you can see by the dates on the side in blue that right now, starting in December of 2025, we're in the public comment period and ecology review. Ecology has 120 days to review, and the last 4 plans I've done in the state, they've been submitting their final comments between day 110 and 119. So I'm thinking we have a few more months till we get final comments from them. And then once that happens, we will respond to Ecology's comments on the plan, make any updates that are needed, take it back to your Solid Waste Advisory Committee for final approval, and then it will go into the adoption process for the cities and counties. There is a mission statement in the plan, and that is that the county and the participating jurisdictions will make sure that the citizens continue to have efficient and effective solid waste collection, handling, recycling, and disposal services with stable rates as low as reasonably possible while protecting and preserving human health, environmental quality, and natural resources. This mission statement is kind of the foundation of your plan as we went through it with the SWAC, going through each chapter, making sure that recommendations met your mission statement for adoption. We also have goals in the solid waste management plan, and they're broken out into 4 categories. So we looked at it through infrastructure and systems. What kind of infrastructure are you going to need for the next 6 and 20 years to make sure that you're managing waste properly and that you have effective recycling opportunities throughout the county available to all citizens? We looked at economic stability, make sure that waste is managed as a resource and that there are sustainable funding mechanisms in the plan and also throughout your county. And then we looked at ways to provide people and businesses within the county education and outreach opportunities so that everybody can make reasonable choices about consumption, waste generation, and disposal. And the last one is outside influences. I think as you're all aware, there are a lot of new regulatory requirements coming down the pike for solid waste, organics, and recycling. And so we wanted to make sure and address those and how the county and the citizens can participate in those things as well. We also have some strategy highlights to present to you. And so basically there's 3 strategies that we kept in mind as the SWAC reviewed the plan for update. The first one is that waste prevention, reduction, and recycling would be continuing priorities, and that you would do that through education and outreach initiatives, and that the cities, counties, and your other partners would all work cooperatively to make education and outreach something that's easily available to all residents. The next one is looking at system enhancements and compliance for not only garbage, but recycling, moderate risk waste, and organics to make sure that you're able to meet the new regulatory requirements if and when they're implemented at the state level. And then the last one is to look at continued proper collection, handling, and disposal of solid waste. And that helps the county not have illegal dumping and make sure that your waste is disposed at a fully licensed and approved landfill. And so, there we go. So next steps. I think, as I said earlier, we're in the regulatory review and comment period. We expect that to run through April 2026. And then once we have the regulatory comments, we'll make updates to the plan. We'll bring it back to the cities and county for plan adoption. Probably looking between May and July for that to happen. And then a final ecology review in August of 2026. So just a little bit of background, we started the update process in July of 2025. We'll hopefully be done in August of 2026. And so most of these plans update take over a year. So you guys are really moving through this really quickly, and that's all due to Shirley helping get the project moving. So with that, are there any questions or comments?
Questions or comments?
Nope.
Nope. Hearing none, so thank you. Appreciate all the work.
Woohoo! Thank you, everyone.
Thank you. Have a good day. Moving on to Commissioner Administrator updates. Mr. Danzel.
Thank you, Mr. Chairman, members of the board. This week, I met with the Auditor's Office, the Accounting Division, to review our current fiscal procedures and departmental alignment for upcoming budgetary cycles. I had a session with Mackenzie Lloyd and our outside counsel when it comes to CBAs. I spoke with Christy Hoffpower at McKinstry. Commissioner Bauman, you had mentioned this previously, and based on our discussion, I requested that we were able to put a workshop together for McKinstry to come in and speak to you gentlemen. Would that be okay in the near future? Okay. I met with Larry Ziegler regarding significant concerns, not just for the budget this year and in the next couple, where we try to fight basically the state Supreme Court mandate. But also, he has analyzed some of the impacts of some of the legislative actions that have been attempted so far in the legislative session over in Olympia this year. And so he's kind of bird dogging that, if you will, for me. And we discuss that regularly. But with that, part and parcel, discussed not only OPD, but just a myriad of issues that the board has made its opinion on, from the independence of the elected sheriff to numerous OPD funding for 395 in the areas that we've had problems. And then I put Mr. DePinto in touch with Commissioner Bauman, because Commissioner Bauman is our representative to the Washington State Association of Counties and the Legislative Steering Committee. I attended the Benton Franklin Health Advisory Meeting, conducted a department head meeting with all the directors. Also want to thank all the directors and the staff for doing such a wonderful job. Met with Pasco City Administrator Stewart and Councilman Perales, as well as Clerk of the Board Teresa Alvarez and Commissioner Didier. And our discussion centered on the potential for land swaps between the county and the city, and future operations and strategic planning for the HAPO Center. And with that, Mr. Chairman, I will go ahead and submit that as my report. But always, I'm able to, whatever you guys need, just let me know, and I'm here for you. We do have a couple pieces of correspondence when we get to that I'll be sending your way.
All right, thank you. Mr. Bauman.
Thank you, Mr. Chairman. Had a long legislative steering committee meeting this last week that more than 4 hours long, as we discussed the upcoming legislative session and prepared for that. And so just appreciate the diligence of all the staff there at the Washington Association of Counties in their preparation for that and preparing those of us that sit on the LSC. Had a meeting with a constituent about the transition to Martin Hall, some of the concerns that they had there, and concern of what our plan was and how that is happening. So I appreciate the diligence of our administrator and the ones that are preparing that transition. Thankful for an invitation to the graduation at the therapeutic court, and for Josh and all the progress that he's made in the challenge that was put in front of him in life, and him taking that head on and being accountable and getting to that graduation. So congratulations, Josh, on your graduation from the therapeutic court. Meeting with the PA's office for litigation and pending litigation and other legal concerns. Meetings with our administrator, including agenda meetings and other meetings. Was invited to attend the staff meeting with the HWL group at the HAPO Center, and was thankful for the invitation. Got to talk with them and reflect on the progress that has been made at that facility over the last 12 months. It was just a couple of weeks, over a year ago, whenever the community came together and did all the cleanup at that facility, and there's just been remarkable gains made. And as I shared with you last week, they're having a challenge of, now they are trying to do multiple events on the same night or multiple events on the same weekend, and it's fun to have those challenges because it presents a lot of opportunity. So thank you for everyone that has been working and helping at the HAPO Center and all the staff there, and let's make 2026 as big of a change as 2025 was, and it's going to be a wonderful year. Just one other thought, not really an update, but a request, I guess, as we anticipate or prepare for this year, taking on human services, veteran services, and numerous other things. Would just ask that our administrator start preparing a report for us of what that will look like. I have a guess of approximately how many full-time employees that will be, that will come under Franklin County's full oversight, and Franklin County employees. And if you would prepare kind of a report of what that will look like, and I think it's time to start getting that underway in preparation for, so that at the end of June, when we fully receive oversight of Franklin County Human Services, as well as all the other services that we are required to administer, that we are prepared for that, and I think now is a good time to get started for that. So with that, Mr. Chairman, thank you.
Thank you. Commissioner Didier.
Thank you, Mr. Chairman. Agenda meeting with Mr. Danzel. Had the meeting with Pasco with Mr. Danzel and Leo Perales and Harold about the land swap. Very productive meeting, encouraging. And then I just, the last thing on my report this week is I want to thank the Sheriff's Office, because Mr. Briggs and myself and Auditor Beaton were part of the canvassing board. We found these indiscrepancies. We alerted the Sheriff's Office, and we have exposed this mail-in ballot is not legit. We got a manager of a building that was voting for people and forging their signatures, and it is happening in this state. And I'm making a plea that we lead the charge in going back to a precinct showing our ID to vote, because this absentee ballot is not working. And the Sheriff's Office has arrested a person. They are not guilty yet. You're innocent until proven guilty, but they have arrested a person that was committing voter fraud in Washington State here in Franklin County. And it made national news, thanks to the Sheriff's Office. That's the end of my report.
Thank you. So had the agenda meeting with Mr. Danzel on the, and then I also see we have a letter from Benton County pulling us out of, or not wanting to renew our contract with the Recovery Center, so that seems kind of, I don't know, blatant disrespect to us because we simply ask questions, but I'll leave it at that. And that concludes my report. So moving on, correspondence as needed.
Well, speaking of that letter, this is part of our correspondence, and I'm going to pass it down, and you gentlemen can take a look. That's from Benton County Deputy Administrator Matt Rasmussen, and it's basically a letter saying that they're going to not sign an agreement that didn't exist in the first place. So it's a little bit confusing to begin with, but there's that. And then we also have a correspondence from Eric Johnson, Columbia River Advisors. And I would just need some direction, gentlemen, on this, but I attached his email and what Eric has recommended for his contract moving forward, which I agree with, but I do need some direction from you. I was thinking maybe you could take a look at this, look through the contract, and maybe we could have it set up and ready to go for next week. And those are the two items of correspondence that I had.
All right. Thank you. Moving on to public comment. Is there anyone in the room for public comment? If so, please come forward, state your name, and you have 3 minutes.
Commissioners, good morning. It's Wes McCart, Director of Planning and Economic Development. I wanted to bring a bill to your attention this morning that I would urge you to oppose. It's House Bill 2201. The summary requires that the county's comprehensive plan and development regulations applicable within urban growth areas conform to the city within the urban growth area. I know that Haley from the city of Pasco has signed in to testify this morning at 8 o'clock on this bill, pro. I definitely want to work with the city of Pasco to align things, but I don't believe that we should be subservient to the city's code in areas that are in the urban growth area. That essentially would mean that we would have to put our comprehensive plan and development regulations under the city's jurisdiction almost, but we would have jurisdiction, but it would align with them perfectly to where everything, their zoning and everything would have to apply to all the donut holes and all the area in the urban growth area. This would also apply to Mesa, Connell, the other cities also. I totally agree we need to work together and try and align things the best we can, but I don't think we should be under the city's comprehensive plan in our own plan. So written testimony is still allowed. I would urge you to consider putting in written testimony and get your lobbyists to maybe work on this bill. I know Wasack is opposed to this bill in the report I got, but I wanted to bring this to your attention this morning. And I'm happy to leave a copy of both the bill and the summary with you.
All right, thank you. Anyone else in the room for public comment? Hearing, seeing none. Is there any purpose for executive session today?
Yes, under RCW 4230-110-1I litigation, I would need myself present along with Ms. Lloyd and the board. Clerk of the board could stay as well. We'll need approximately 20 minutes. Yes, sorry, and Mr. Danzel. Sorry.
All right,
You're out.
So, Mr. Chairman,
yes.
before we recess into executive session, Mr. Danzel, can we put one letter together, or should we all put a letter together opposing House Bill 2201?
Thank you, Mr. Didier, Commissioner Didier. I am right now about ready to hit send if you'd want me to oppose the bill that Wes just said. We can empower our lobbyists to do such. They
Yes.
can, would you like to do that?
Yes to all the above, please.
Okay.
Yeah.
Yes. All right, thank you. And I'm sorry, Mr. Briggs, how much time do we need?
20 minutes.
20 minutes. I usually undershoot it, but we'll go with 20 minutes.
All right, thank you. So it's 9:28. We will return into business at 9:48. So at this time, I will put us into executive session. Thank you. We've come out of executive session with no decisions being made. We are going to enter back into executive session for an additional 10 minutes under the same RCW code. Time is 9:50. We'll return at 10 o'clock. We've come out of executive session with no decisions being made. Is there any other business for the good of the county?
There is, Mr. Chairman. I would move that we amend our agenda to add a potential action item.
I second.
Motion and a second. All in favor signify by saying aye.
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 And with that, Mr. Chairman, I move that this board authorize our prosecuting attorney's office, our county administrator, and one member of this board to enter mediation with Benton County about some of the issues that have been happening in relationship to the Juvenile Justice Center.
I second.
We have a motion and a second. All in favor signify by saying aye.
Aye.
Motion passes. Any other business for the good of the county? Hearing none, this meeting is adjourned. Do we need to take a break before our workshop?
5 minutes.
We'll break for 5 minutes and we will start with the workshop. Wednesday, January 14th, time is 10:10. We are here for the workshop. I'll call the workshop to order. I have approval of the workshop agenda.
Mr. Chairman, I move for the approval of the workshop topic of update on the Columbia Valley Center for Recovery and comprehensive overview of the first responder program.
Is there anyone in the room for public comment related to the
Yes.
workshop?
We got to approve it.
Oh, I'm sorry. Move approval of workshop agenda.
Second.
We have a motion and a second. All in favor signify by saying aye.
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 Motion passes. Public comment. Is there anyone in the room for public comment that relates to the workshop agenda item? Please come forward, state your name. You have 3 minutes.
I think we're just getting in position.
All right. Hearing none, we'll start the workshop. Update of Columbia Valley Recovery Center and comprehensive overview of the first responder program presented by Jason Bliss, Chairman of the Bi-County Advisory Board. Good morning.
Good morning, Commissioners. Good morning, Commissioners. Happy to,
Could you pull it up just a little closer, please? Thank you.
does that work? There we go.
That's good.
Good morning, Commissioners. Happy to be here with all of you today. I took the time to listen to the past couple Commissioners meetings that you guys have had here, and listened very intently to Commissioner Bauman, some of the questions and such that he has had around the Columbia Valley Center for Recovery, specifically around the funding, what that was going to look like, exactly what funding was going to go to. I've had the privilege of the past few years of being the vice chairman of the Bi-County Advisory Board, and most recently was elected in as chairman of that board. We all know and we can all agree that addiction has continued to ravish our communities, not only on the Benton side, but also on the Franklin County side. I was there and in the room and present with most of you year and a half, 2 years ago now, when we all met over there and we had discussions around the 1/10 of 1% and how we could get together and fund this to be able to bring an all-inclusive center to the Tri-Cities, to be able to serve the individuals here in both counties, here locally, to be able to help them, get them stabilized when it comes to drug addiction and mental health issues. Again, I know that there has been some question and concern around funding, what funding may or may not look like, what the total cost has been for the project, what perhaps phase 2 is looking like. My goal with coming here today and being in front of all of you, above and beyond anything from an advisory board standpoint, I want there to be full transparency. I have no desire for anything to be hidden. I don't want there to be questions out there lingering that you guys can't answer to your constituents and the people of Franklin County about what those dollars are being used for, those tax dollars. I don't want there to be questions. I don't want there to be concern about the 1/10 of 1% that you all graciously enacted to be able to bring in revenue, to be able to assist with this program over there. I realize that there's a menagerie of things, we'll say, that are going on between Benton and Franklin counties, and to be honest, I have complete faith that at some point you guys are going to be able to get that hammered out and be able to work through that. I'm just hoping that we can still stay on track as community members and people residing in both Benton and Franklin counties to get the individuals in both of our counties the help and the services that they need. And with that, I did not prepare a PowerPoint. There's been some comprehensive has shown some PowerPoint, some drawings and such have went around over the past few months from the Bi-County Board showing progress and such like that. Again, my biggest reason for coming here in front of you all today is to do my very best to answer any and all of the questions that you have. There may be some questions in full transparency that I might not have the answers to today, but one thing that I can assure you, I will do my very best to get those answers to you so we can still continue to move forward and get the individuals in our community the help they need. And with that, I will Courtney Hessla has joined me from Comprehensive. She's also here with some of the executives from her organization. Between all of us, we'll do our very best to answer your guys' questions today.
Questions, commissioners?
Thank you both so much for being here, all of you that have come with this. And I have dug in diligently over the last 2 years, and I believe that there's some large questions that have not been answered fully. Since the meeting that you described, where that I asked those questions very carefully, I would say since that time, which is about 2 weeks ago, that I've gotten more information in that 2 weeks period of time than I have in the last 2 years as a commissioner. And so I'm a land developer and a consultant that builds commercial and residential, and the numbers have not made sense to me, and I've tried to ask questions so that I could get a comfort to where that I wasn't concerned about it. And I agree with you wholeheartedly that this community needs this Columbia Valley Center for Recovery and the services that it will have. I think that it is vitally important. As I've said before, I believe it was approximately 12 years ago when Trios was in the process of building a new hospital, and there was the potential of this facility coming available, that somebody, I don't know who it was at that time, but somebody came and asked the Board of County Commissioners here for, if I remember correctly, it was $13,000 to do a feasibility study for, they wanted to see if there was lead paint and asbestos in that facility. And I was in the audience that day, and after they got up and asked the board in the public comment for that money, I got up and asked my county commissioners to approve that, to help with that. I've seen and known for a very long time that this was critical in this community. And I don't have a lot of formal education, but what I do know how to do is work hard and study and ask questions and research. And as I've done that a lot over the last 2 years, certainly as a commissioner, I did it before, but from a different perspective, there's questions that I've had that have not been answered to my satisfaction. A part of that, as I mentioned in that couple of weeks ago, there's a facility that does a very similar process over on the west side of the state that was built, and they couldn't figure out how to fund it, so it sits empty today. And that would be a travesty or a tragedy in our community if we're building something so big and so fancy that we cannot afford to run it. I've come to the Bi-County Board of Advisory Board and asked questions, and that has been met with what has surprised me, the resistance that I've received as I have asked those questions. And I want to figure out how to help. If I don't know the problem, I don't know how to help with a problem. The numbers that I've seen haven't made sense to me. That's why I'm asking the questions. And so I'd like to know how we're going to do it. Our federal partners and our state partners have said consistently, as far as I can tell, that they'll help build it, but it's our responsibility to have the funding stream to run it. And I want to help be a solution there. But if I don't know the problem, I can't be a part of the solution. And for the first time, I got numbers in the last 2 weeks of what is the proposed comprehensive cost of of running the facility. I don't have a lot of background behind it, so I don't fully know what it means. But for it to be a little over $13 million to operate the facility, I hope that's the case. It's new. I haven't had time to research it a lot to understand what's the background of it, but would love to hear more.
Sure. I'll open up a little bit, and then I will, with a few comments and numbers. $13.8 million is the operational, 13.8 is the operational cost. That in full transparency, that is a good faith estimate, in my opinion, on Comprehensive's part. There will be different service lines, as you know, different services that are provided there within the facility. To answer your question directly, where will the funds come from to be able to run the facility? As we all know, just like the facility you spoke about over on the west side that closed, I can't comment on one way or another if that provider wound up pulling out because they could not figure out a way to fund it, or if there were other issues. But some facts I do know to be certain. There's facilities like this all over Washington State that are closing at an alarming rate. For a wide variety of reasons, whether that be reimbursement rates that are available, or many other things that could play into that. If this facility, when it opens and gets to full capacity, and I have no reason not to believe that they will not be at full capacity within a short period of time, simply because the amount of beds that are unavailable, not only across Washington State, but the amount of individuals that we have here in our local community that need the help. If those beds are full, and again, which I fully anticipate them being, as long as the managed care organizations are able to pay and reimburse Comprehensive, as happens across the rest of the state, this facility will not operate as a deficit. They will actually have the potential to be able to make some money. The only cost that I see that's kind of up in the air right now is if we have individuals that are in there that do not have the ability to get insurance for a wide variety of reasons. That is when that 0.1% money can be used on both sides to be able to help cover the costs of having those individuals there. But the way that this is set up as a whole is not to operate in a deficit, but rather just the opposite. And in my professional opinion, this facility will fill rather quickly, and revenue will be able to be generated. I'll turn this over to Courtney and let her elaborate on that a bit more.
Good morning, Commissioners. Forgive my voice, I'm getting over a cold like everyone else. My name is Courtney Hessler. I'm the Chief Quality Officer with Comprehensive Healthcare. I have some colleagues with me to also help answer questions. I think I'll just start by offering just a little bit of history in regards to our involvement with this project. Comprehensive Healthcare is a behavioral health organization that's been operating for about 50 years in the Yakima Valley, and we've extended our service reach into other counties as well. Comprehensive provides what I call or refer to as the full continuum of care. We offer outpatient mental health and SUD services in addition to residential mental health and SUD services, progressing into inpatient mental health services. We provide these services for youth and adults. We operate multiple facilities that mimic what's going to be opened at the CVCR, so we're very familiar with operating these services. When the RFP was issued back in 2022, we applied for that RFP and were eventually awarded to be the contracted provider. And that's how we've been involved for the last now 3 years with the project. I personally have worked very closely with Boughton and NAC in this project to ensure that the facility is built to the highest standard. We're a Joint Commission accredited agency, so we also wanted to make sure that this facility would meet those standards as well. So 3 years ago, when we applied in the RFP, we were asked to put forward a proposal that would explain how we might open essentially 4 service lines. One being crisis stabilization, another being 23-hour observation, which is now called Crisis Relief Center. Also to provide a secure detox, and then finally an SUD residential program. So that's what we outlined in our RFP, is providing those services. Did our best to estimate what the staffing pattern would look like to run the clinical end of the services. We recognize, over 3 years with some modifications to the services and funding streams changing over the last 3 years, that our staffing pattern today looks a little different than it did 3 years ago. I actually spent last night going one for one by those 2 staffing patterns to really identify the total number of FTEs that we differ by. And then Mark Kettner, our CFO, is here to also offer maybe Commissioner Baumann some context around that $13 million operating cost as well. I think the bottom line for Comprehensive is that we're just here committed to providing services to the residents of Benton and Franklin County. I myself live in the Tri-Cities and have for 20 years, and really am committed to providing high quality services to those who need them. And we work really hard to ensure that anyone that comes to our facilities or outpatient services have a payer. So just rest assured that anyone that we serve in these facilities, we will do our due diligence to make sure that if there's a way to get them funded, either on state Medicaid or another grant or contract, we'll do that, so that we minimize any responsibility to the counties to cover those individuals who we just can't get a payer for.
Go ahead, I ask a bunch of questions.
No,
already.
go ahead.
Well, thank you so much for that. For some context, for those that didn't hear some of my questions before, as I've been a commissioner for 2 years now, and trying to understand the needs of this facility and the cost of this facility, because the information was not forthcoming, I found on Comprehensive's website, the Columbia Valley Center for Recovery website, at that time it was indicated that would roughly 150 employees. It said, it didn't say FTEs. It was clarified that that's 144 FTEs. So in the absence of getting more information, I surmised some information, and so for full transparency, where I surmise those information is as somebody that currently sits on a hospital board, and I get reports, month after month, year after year, of Medicare, Medicaid reimbursement rates, and some of those kind of things. I tried to have an understanding of what was going on and where the funding for this facility was going to be. So, if we're talking simply payroll, 144 FTEs times the cost that I was able to find on the open market, that the cost in a healthcare setting of an average employee, including burden or including benefits, that number is $140,700. So if you take $140,700 times 144 full-time employees, that's well over $20 million. So then I took that number and I took it towards the cost of what an employee here at Franklin County cost, because I just needed something to measure it against, a little bit of perspective, so I could get some numbers. And if you take Franklin County's cost of an employee times that number, that's just short of $16 million. And so then Mr. Bliss, your predecessor, indicated he thought it was closer to $90,000. And so $90,000 times 144 FTEs is just short of $13 million. And then the cost to run a commercial, hospital-like facility it's very expensive. You got to plow the snow, you got to buy toilet paper, and you got to keep the lights on. And so that's where that I've been trying to have an understanding of what it's going to cost to run the facility, and then go take the information that I have access to and try to lay it side by side and say, is this reasonable to, are we on the right track? I just haven't been able to get enough information. So that would be helpful to have some perspective of payroll and operations of the facility, how it is $13.8 million going to do that.
Yeah, I'd certainly invite Mark to come up and speak in detail. One thing that just another layer of complexity on everything too is payer mix. And we're familiar with the payer mix, obviously, in the counties and the communities that we operate these services in. Benton and Franklin, while we provided outpatient services here for many years, inpatient residential services, we're not as familiar with the payer mix. And so when Jason references estimate, it truly is an estimate. And we're looking at some of the similar numbers that you're looking at in terms of Medicaid mix compared to, for example, private insurance, because all of those payers pay differently for all of these services. And so it is very challenging to try to estimate what we can expect coming in, given those differences in payers. But we're using, again, our working knowledge and what we've done for the last 50 years to come up with the numbers that we have come up with. Our scope of staff range anywhere from a high school level, high school graduate level, all the way to a provider, an ARNP or higher. So there's definitely a large range in salary. So that average is definitely thrown off by those extremes. So. Mark, is there, you want to take the big stand?
I can take the stand. Hi, good morning. I'm Mark Kittner. I'm the Chief Financial Officer at Comprehensive Healthcare. And I've worked in acute care hospitals for a number of years myself as well in the finance area. So I understand, where you're coming from in that regard. And the difference is that in those acute care hospitals, those acute care facilities, the cost of care is much different. You have a very high acuity with a lot of the patients there, right? Where you have, the expensive machines, the equipment, MRI machine, or, the cath lab and that kind of stuff. And it's extremely expensive to operate those facilities, in addition to the overhead of maintaining those facilities and running those facilities as well. What model that we have in this behavioral health is a 16-bed facility. And in essence, we have a number of these throughout the Yakima Valley, majority of them in the greater Yakima area itself. And we operate these facilities in a way that we're looking to have them stand alone as a 16-bed facility and still be profitable, or at least break even. And so we're able to do that, as Courtney was saying, the lower level of education experience that is required for some of these staff members is a little bit more on the lower level than it is on the physicians and nurses and that kind of thing. Where we do have physicians or medical providers in those facilities, we are able to share those among those 16-bed units. So we don't have a dedicated person, one dedicated person. We might have one between all 4 units that we'll be able to share and pull between those different units. Same thing with nursing. And the other higher cost labor such as that. So that pulls down that cost dramatically. The other thing is the cost of supplies. So in a medical environment, you have those high dollar pieces of equipment. You have the robots that are running around the facility that are either helping with surgeries or delivering medications or supplies, whatever it is. You don't have that in these types of facilities. They're more a home-like environment, maybe would you describe it as that? And so we're trying to help with this lower cost or lower setting environment, 16 beds, and trying to make each one of those standalone as best we can financially to make sure that they're successful. With that, we have had success in that as well. Some of those facilities we are very successful on standalone financially, and others they have a little bit of difficulty. And I think some of the ones that we were talking about earlier, some of the crisis facilities, are a little bit more difficult. The thing that is really the unknown is the 23-hour observation, right? That's a new facility to the state of Washington, and we're trying to figure out what that looks like. And I think there's been some attempts of that here in the state. And some of those have been successful. Some of them are still trying to figure that out, and so that's an unknown to us as well. But we're willing to work through that. We've had our financial projections are showing that depending on what that reimbursement rate, it could really come out very well for the facility as well. So we're seeing rates anywhere from $50 an hour to maybe $70 an hour, and it just kind of depends on where the state and ultimately decides to contract with us on that as well. So the other thing, Courtney talked a little bit about was the payer mix and or finding a pay source for clients as they come in. And where we have a lot of focus on the clinical side and the quality of care that we provide, the other side or the back office functions, if you will, are as successful as I would say as the clinical side is. And I think that lends to the success of the agency overall by ensuring that we can find a pay source for these clients as they come in. A lot of them, may not have that ability to share what their pay source is or, what their information is at the time of admission. But we have staff that, as soon as somebody comes in that front door, we're working with them to identify, who they are and any potential pay sources that they might have because of, the continuity of not only their care, but the overall agency as well to ensure that we have some sort of pay source. And we've been successful at that. And we would take that same model and replicate it here in the CVCR as well. We wouldn't want to have a deviation from that protocol. We want to make sure that we're taking that model and continue to replicate that and exhausting all avenues for any particular third-party pay source that we can for any client that comes in the door before we look to anybody else, the county or the ASOs or anybody, before we look for a pay source on those particular clients. So anyway, that just kind of a summary of what it is that we're looking at today. What kind of questions do you have?
Well, thank you so much. It's clarity and communication is very helpful. That's very helpful. I'll just hold my comments for a minute. I don't need to take up the whole space.
Good questions.
I have a question, if I may, Chair.
Yes.
Sure. So I would just start by echoing your comments, Mr. Bliss, about the importance of the facility in general. I've lost friends and family members to drug addiction, so I know firsthand how the impact that has. And I worked as a defense attorney and prosecutor on the criminal side of things for years, and so I get the connection between drug addiction and recidivism. But my question is more of I guess a simpler one, and I don't know that I've had an answer yet. It's related to what Franklin County is receiving for the millions of dollars it's using, because as a prosecutor for the county, and I know the board, we all want to be good stewards of Franklin County tax dollars. And this Benton County facility, when it is profitable, those mental health funds will go into that facility. Presumably at that point, Benton County could use that in their general fund if there is a profit. So I guess to get to my question, it's what is Franklin County receiving for the millions of dollars it's providing for the facility, and how is what Franklin County is receiving, how is that any different than what Walla Walla receives, or Pasco, or Yakima County?
Sure.
Because it seems, and we received that email from Matt Rasmussen, who basically says the same thing, that we will have equal footing with these other municipalities and jurisdictions when the facility is built. So I mean, our citizens will certainly have access, but I don't know the added benefit we are getting from providing tax dollars for that facility.
Sure, absolutely. And it's a very fair question. Very fair question for all of you commissioners and for the taxpayers from Franklin County to know exactly where their funds are going. I will say also, as a member of the Benton Franklin Recovery Coalition, when a group of us got together and first started planning this, the whole thought and idea behind it was to be able to bring a recovery center and to be able to provide those services to the members of our local communities, as we currently, as you're all aware, have nothing here and have to send people out of state. When one of these facilities open, and when it comes down to the state and the managed care organizations' reimbursement, yes, the facility that's going to be operated over in Benton County has the potential to be able to bring in and assist people from all over the state. But with that being said, the whole reason that this facility was built was to give priority, when beds are available, to the individuals in both Benton and Franklin County. So to answer your question directly, what benefit will the folks in Franklin County have? Our mission from planning this and bringing this to fruition has not changed. It's to be able to offer the residents of Benton and Franklin County the availability to be able to get the services that they need here locally on a priority level without having to send them out of our local community.
But are we permitted then to give preference to one individual based on where they reside? Because I know when we had pushed, when we had initially provided the money to Benton County, and we wanted some sort of assurances that we could have folks in that facility, like a guaranteed number of beds or anything on the rates, Benton County kind of pushed back and said, well, no. And I believe they might have tied it to the grant money that's coming in. But I'm not sure what I'd have to dig up the old email, but essentially they said that they had to treat everyone equally regardless of where they reside. Is that not the case?
As far, and I'm going to let Comprehensive jump in here a bit, but as far as my understanding is, anybody, quote unquote, reserving X amount of beds and not making them available to residents across the state would be unlawful. However, giving priority, again, to the individuals in Benton and Franklin County is something that we most definitely can do. I understand the email. I had the opportunity to read the email that was sent out this morning that in an interlocal agreement is currently not possible between Benton and Franklin counties in regards to this. But with that said, I would encourage all of you, including Comprehensive, you guys do have the ability to be able to come up with some sort of agreement. And I would hope for everyone within Franklin County that that is able to happen. But I'll let Comprehensive touch on that a little more.
Yes, and just keep in mind, we're just the service providers. And so what I can say is, one of the services that we're providing is the Crisis Relief Center, as Mark said, is a new facility to the state of Washington, but it's defined in statute essentially as being a no wrong door facility, which means we would have to take anyone who arrived to the door of that particular facility into our care, unless, of course, it just wasn't medically appropriate and they needed a higher level of care. The other three services, the residential, the secure detox ENT, and crisis stabilization, don't have those requirements. And I can say that historically I've been part of organizations where beds were purchased essentially by the county government to be held for particular individuals under certain circumstances and certain conditions. So I don't know that there's anything preventing that type of agreement where beds are, I'm going to use the word purchased and held for individuals meeting certain criteria. So I don't know that that's off the table. In general, though, when I became part of this team working on this project, obviously not extremely privy to the financial piece, but I do believe that all the funds that have been contributed by Franklin County have went towards building, again, this very, I don't want to say comprehensive facility, but a facility that does, again, have that continuum. You can move individuals through the facility and ensure that they have a better chance at recovery. And so you've contributed funds to build that a wonderful facility for your residents. And so moving forward, I think the discussion that Jason is referring to is that kind of operational then. So now what? We've built the facility. How can the counties contribute to its operation? The services we provide, we're billing for those services, we're finding the payers for those services, we're handling all of the administrative lift and the back end of all of that. But again, there could be some things that this commissioners, you may want to look at regarding a partnership or an agreement with us to ensure Franklin County residents have those who do not have any funding type of any sort are cared for.
And Mr. Briggs, one other thing that I would like to add, it's in my years of providing recovery housing here in this community and housing a great number of people and working within the criminal justice system and working with various different members of law enforcement from the city of Pasco to the Franklin County Sheriff's Office and all around our area. One of the things that has continued to happen for a very long time are members of law enforcement, including the Franklin County Sheriff's Department, when they run into an individual who may be in need of help, they have really had no place to take those individuals except to the Franklin and Benton County jails. As a result, both of our jails have been turned into defunct mental health facilities for no other reason than there was no place for them to go. One of the other benefits I feel that is key and important, the Franklin County Sheriff's Department, the City of Pasco will now have a place that they're able to take these individuals to get the help that they need, rather than taking them to the correctional facilities and hoping for the best.
Thank you. Thank you.
So what happens when they drop somebody off and there's no beds?
As many beds as there are, it's kind of hard to wrap my head around that. But when individuals are dropped off, either by law enforcement or EMS, or even if they're walk-ins for that matter, they would be triaged to determine what, I'm going to refer to them as facilities, they're most appropriate for. So if by chance there wasn't an appropriate bed for that individual, our crisis team, the designated crisis responders, are also going to be working out of that facility. So between them and the triage coordinators that we're going to hire, we would resource them to try to find an appropriate place for that individual, as we currently do, out of the community if that's what's needed. But we also look at local resources. Sometimes they don't necessarily need a high acute level bed, but maybe between the mission or other outreach and housing programs that are here locally, we can access those to come in and help. Forgetting some of the names of the outreach programs that are here in the community, but we've gotten pretty good at identifying those resources through the crisis team that can be brought in to help assist with individuals. We'll have agency vehicles that we can also transport individuals. So if we do need to get someone across town or to another location, if someone is brought to us and they're just not medically stable, like we couldn't appropriately care for them, then we could transport them, if appropriate, to a hospital. We've had some early conversations with some of the EMS and fire departments about, what that could look like too, for them to help support us, because we just want to make sure that we're not turning anyone away, or we're at least linking people to resources. There is some flexibility with the Crisis Relief Center to go over the licensed bed number for overflow. So all of the, for example, beds might be full in the Crisis Relief Center, but we are allowed to bring someone in, and maybe they can be on the milieu and have a shower and, some food while we're working to discharge someone else and then move them into a bed. So those are all the types of different things that we work on so that we don't have to turn someone away.
And Commissioner Mullen, I'll say Tri-Cities has a lot of great resources, and there's a lot of currently ancillary services that are being set up around the recovery center. For instance, some of the individuals that law enforcement run into, some of the individuals that find themselves in mental distress, a lot of it comes down to simply them being unhoused, them not having anybody to talk to, them not being able to work through those issues that, for lack of better words, are debilitating them. Right across the street from the recovery center, I just recently opened up a recovery cafe over there. We've got peer services that are there and that are available to be able to chat with these individuals. Outpatient services are all over Tri-Cities and readily available. The good thing about a no wrong door approach, the facility that is opening might not be all things to all people that are coming in, but with partnerships, community partnerships that are ongoing, those resources will be there and will be available to get these individuals the services they need, rather than, again, law enforcement or whomever having to take them to jail and hope for the best.
So if law enforcement brings somebody there, they're never going to be turned away.
As long as there's a bed available. And if I can make the overflow work, I will make that work.
We are taking a no wrong door approach was what what the whole idea behind this is. Can I sit here and tell you that there may be a time that law enforcement might show up and all of those beds might be full, or all of those resources in our community might be maxed out? No, in the world we live in, we can never be that sure. But what I can assure you is that when the individuals are brought there, that every opportunity is going to be afforded to them and to the members of law enforcement or whoever's bringing that self-referral there to get them the services that they need.
And our goal too is to clear that officer as soon as possible. So even if the officer does drop off someone and all 20 recliners in the crisis relief center are full, we're still going to bring them into what I'm calling the triage area, and allow that officer to clear and return to work. And then it's on us to either go through the overflow process and put them on our milieu while we someone who's slated to discharge. We're waiting for that to happen. We also have 16 other beds in the crisis stabilization unit that if they meet that criteria, we have those 16 beds as well that we can move the individual to. Again, this is all complicated by the different types of services the units provide, the payer mix, and the criteria that managed care organizations put on those services, that you have to be at a certain acuity before they'll pay for those types of services, even though there's a bed available. And someone is just shy of that criteria, managed care companies will deny those claims. And so, again, that's, our back end that's working those claims and working those denials and trying to resolve those issues.
How many total beds are there going to be?
So there's, I should have this number memorized by now, but I think it's 68 beds. So there's 3 facilities with 16 beds, and then the Crisis Relief Center has 20 recliners. So I think that's 68. Somebody math for me, but yes. 16, 16, 16, 20.
Yes, Mr. Ballin, I'm sorry, Administrator.
Yeah, thank you, Mr. Chair. I guess my question revolves around more of like the unknowns. And so, the state of Washington, about a dozen or 14 years ago, were in an RSN, Regional Support Network model. That kind of went away. Now it looks like we're kind of going back a little bit-ish to that in some capacity. So I guess do you see any changes on the landscape with that? Because since I've been involved, I think there's been like 5 different ways that we've done this from the state level.
I'll give my 2 cents, and then Mark might want to jump in too. Yeah, I mean, just during the time between when we were awarded this RFP and today, there's certainly been changes. So yes, it used to be called the RSN, now it's the ASO, and they manage the money for unfunded crisis services, essentially, distilling it down very simply. And then we have multiple managed care organizations that represent those that are enrolled in Medicaid. Again, each MCO is different. They have different contracted rates that we have to enter in different contracts with them. And then the ASO they manage the money that the state gives them to manage. And so the question is whether or not the state is going to invest any more in putting more dollars into the crisis services pot. Right now, the money is what the money is. And as Jason referenced, they also want facilities built, and facilities are getting built, but not necessarily putting more money in the pot. So that becomes a legislative advocacy thing, that we're working on and hope others work on as well. So we also know that the recent change with HR 1 is reducing the number of Medicaid eligible individuals. So there will be more individuals in the state that are no longer eligible for Medicaid. We don't necessarily know, however, how that plays out in Benton and Franklin County. We don't know if more individuals will not have Medicaid in areas like King County, Pierce County, or how that's going to trickle out. So that's an unknown for us as well. Mark mentioned the Crisis Relief Center is, again, new, and that will be a new contracted rate for us. We're not really sure where those MCOs are going to land on their rates. We could have 4 different rates by the time it's all said and done. So, yes, definitely a lot of things that we're currently managing. I don't know if you have more about like what's on the horizon other than what we've shared about this, our own CCBHC and.
Yeah, so it's an ever-changing landscape for sure, and so yeah, I can appreciate your question. I think though, what Courtney said about the ability to work with the legislators and continue to advocate on behalf of what the changes will do or impact the operations of these facilities. I think that's where we see the biggest benefit. I'm trying to think, it was earlier this week, maybe yesterday, I was reading a bill that's being proposed that would essentially do away with the MCOs, and it would take all that money that they're allocating to the MCOs and pull it back to, I think it's HCA, right? And so we would just contract with HCA, and I think they're looking at doing that on January 2027. Seems like a pretty lofty goal to happen by that time, but it's still, I think, an indication or idea where, the state may be going. And so we're always watching out for those things, trying to be aware of those proactively, right? And then advocate, through the legislators or, lobbyists or whatever it is to help understand and help them understand what those impacts are going to be on the services for the people in their communities that they're representing. So I think that's a very important thing to do, and we're always aware of that and doing that each legislative season.
Mr. Chairman?
Yes.
Yeah, so after hearing all the discussion, I have a few questions. First is for Jason. When we put out the RFP, how many caregivers besides comprehensive replied?
1.5.
Thank you. Number 2, you made the statement that facilities all over the state are closing. We're going to become the magnet. 64 beds isn't a lot of beds. They will bring them here. I have a problem with that because I want to take care of our constituents. You made the statement, Courtney, that we could purchase more beds to hold them. Is that above and beyond what we've already put into this facility? That we'd have to come up with more money to purchase these beds?
In the past, the agreements that I've seen regarding holding beds have been, again, either with counties or local entities, and that's been just an annual bed rate agreement. So again, I'm making probably an assumption here that the money that's so far been committed by Franklin County has went into the design and build of the building, and then now moving forward, it's the operating of the building. So I would say yes, that would be an agreement where there would be an agreed upon bed rate that would be paid again only for those without coverage that we could not obtain coverage for, that meet your conditions and your circumstances. Again, there's 4 different services in this building that, again, if there is a payer, they have conditions, right? So in Yakima, we operate 3 evaluation and treatment facilities, a crisis triage center. We don't have the experience of, for example, West Side folks coming over to Yakima to access those services, mostly because, again, you can't just walk into an ENT and say, I'd like to be admitted. You have to be evaluated, and it has to be determined that you meet that level of care, and that usually happens through designated crisis responders, although some facilities can take people voluntarily. But again, the 23-hour or the Crisis Relief Center is the only facility of these four where the statute commits us to operating it as a no wrong door, so that we take everybody in as long as, again, we can treat them
you have a
safely. Yeah.
Couple more, I think it was, none of you were here, but we had the other gentleman come and present, and he said that there were going to be 3 teams of designated crisis responders.
So there was a separate, I don't know what to call it, initiative that the advisory board wanted to pursue using the 1/10 funding to fund mobile, I'm going to call them mobile outreach teams. So we operate, Comprehensive operates the current crisis response team that's made up of the designated crisis responders. The advisory board wanted to pursue 3 mobile outreach teams to blanket the week, 7 days a week, to go and respond out to calls being initiated through 911 and law enforcement. The advisory board has since pulled back on that, and so we're not working towards that with them right now.
Yeah, because then we're just layering it up. We were told that our law enforcement would be able to drop these off at the door, the
Yeah,
people that were needing help.
They will,
And
yes.
that's what we'd like to see.
Yes.
I wouldn't like to see more hirees, because we know in the government that people working for the government, their salaries, benefits, that is the biggest cost for the government. And this is going to increase our cost. We have a certain amount of funds. You know, we talk about grants, but when the grant funding's not available or it doesn't come through, the taxpayers have to pay the bill. And we're trying to make sure in this time that's pretty stressful right now out where I live in the farming community. There's not a lot of money to go around right now. There's going to be some people going bankrupt, and when they see this and what we're seeing across the nation with the child care and the amount of money that's been fraudulently taken, I'm glad we got a board of commissioners that are asking the tough questions, and we need to, because we got to be good stewards of the taxpayers' money. Thank you.
Agreed.
Commissioner, I would echo a lot of your sentiments and where you're coming from. The Bi-County Board, we had some discussions earlier on about putting this in place, but after some further investigation and figuring out, we currently have designated crisis responders here in the community. That, in conjunction with the new facility that is opening, I feel will get us to where we need to without adding that additional cost and burdens that you were speaking of.
Thank you.
So the conversation has been very helpful. It's also raised a few additional questions for me. So going back just a little bit, we received communication that, Jason, that you referenced, and we got a communication this morning addressed to this board and our administrator, and I'll just read the first sentence of it. It says, at the regular meeting of the Benton County Commissioners on January the 13th, 2026, our board provided direction that we would not be seeking to enter into a joint operating agreement with Franklin County for the Columbia Valley Center for Recovery. So that is caught me off guard that they were not seeking to, work with us on the Columbia Valley Center for Recovery. So there's a lot for me to unpack and understand there. But you referenced, and also in this communication, they referenced that we are welcome to enter into a contract with you, but I don't fully understand what that would mean. If this is a one-stop shop that anybody can walk into voluntarily, what would a contract between us and you look like, and for what purpose would it be?
Go ahead.
So, the way I am thinking about that, I just found out about this this morning as well. So, the way I'm looking at it is, it could be a contract where we would enter into with Franklin County to be the last payer of resort for any client or any resident of the county as they come in for services, right? So a resident of Franklin County comes in for services, we would continue to go through that process that we do today at any one of our facilities where we're looking for a pay source, whether or not they're Medicaid or private insurance or whatever it is, and exhaust all those avenues first. And then once we get to the point where there is no pay source for them, we have them complete what we call sliding fee scale application or charity care application, right? It's for the people that have no financial means to pay for the care but still needs that care. Those would essentially be the folks that we would end up passing along to the county for payment, maybe some sort of rate, depending on which facility and the number of days. It might be a daily rate based on that, similar to what the MCOs might be paying us, and then looking at that. But it's all part of the contracting process that we would have to work with the county on to get that figured out.
Yeah, it'd be interesting to know, better understand, because it's been fairly clear throughout that, as we discussed earlier, there's not a priority. If we were to be a part of this process, that we don't get a priority or a number of beds or any of those things. And so the appearance on its face is that whether we pay or not, Franklin County residents would have access. So that takes me to another question. So we've got these kind of 4 different units and 4 different services that can be provided. Do you have, well, you would, you've broken it out in a cost per day per bed of what it's going to take to run these different ones. Can you share that with us, what that's going to look like?
While he's looking, I just wanted to add that out of the 4 facilities that Franklin County residents would have access to the Crisis Relief Center, that is limited to 23 hours and 59 minutes. It would be, again, I don't anticipate that. I've not yet seen a county commit funds for a co-occurring program or an evaluation and treatment program. Those are very high cost, high acute services. It would be more for the crisis stabilization unit that such a contract might exist for. And the crisis relief center with 20 recliners, it does become problematic if there's a lot of individuals accessing that don't have any payer. And that's where that payer mix piece comes into, it's depending on the payer mix and the capacity, the census being full helps us to deal with when we have a couple of people that don't have coverage. And you referenced the ASO, RSN. Obviously, we are drawing down those funds until they're exhausted before we're going to any other payers, such as a county. So yeah, I just wanted to add that it would just be the Crisis Relief Center that the Franklin County residents would be able to access, as long as we can continue to provide that service, given that it's 20 recliners and don't really have any idea what the payer mix is here.
So Franklin County would only have access on a walk-in basis to the 20 recliner crisis relief center. So everything else would be a DCR, what's the right word for it, designated to put somebody in there. So the 3 units that have 16 beds apiece, those would be DCR criteriaed, would have to be, those beds would be allocated by a DCR, and then the voluntary walk-in would only be to the 20 recliners, which is the Crisis Relief Center. Is that accurate?
Almost. The crisis stabilization and the ENT secure detox, those 2 16-bed units, would be, I'm going to use the phrase, gatekept by DCRs. because you have to meet a certain level of acuity to access those services. The co-occurring residential program, those are individuals who have had a specific assessment that shows that they need residential level of care to help with their substance use disorder. DCRs are not involved with that at all. So that facility would receive referrals from local SUD providers here in the Tri-Cities, for example, and be accepted based on those referrals. And again, we would look for a payer for covering those services, because the length of stay in that unit is anywhere from 30 to 45 days.
So we've got the 4 CVCR units, and then we have, separate from that, we have the housing component.
Correct.
Yeah, thank you.
So, Commissioner Melvin, just to be clear, because I don't want any confusion, there will not just be one part of the recovery center that will be accessible to Franklin County residents. Irregardless of an individual's come in there from Benton County or Franklin County, they will be triaged, they will be assessed, and they will be afforded that same opportunity just as anybody else would. And like I said, if a contract and MOU may be able to be figured out between you guys and Comprehensive as to what that looks like, I just want to be clear that it's not just one unit that the individuals from Franklin County will have access to.
Thank you. Thank you for that. Did you have some numbers for us for kind of the cost per day per bed in those 4 units?
Yeah, I do have some information, but I got to be careful on sharing cost per day, because that kind of gets into some of the proprietary information that probably couldn't share in this forum. But I do have some information I can share. Something I put together for, what was it, the last meeting at the, not the last one, but the one before in November, was it? Mm-hmm. At the advisory committee meeting, and I have some information I can share.
Sure.
While you're sharing that, I'd like to ask another question, Jason.
Yes.
You mentioned the Crisis Cafe,
Recovery Cafe.
and it's located right across the street, you said?
Yes.
And it's open at this time?
It is.
And what kind of participation, and when do you meet? Is it welcome to people to come and visit?
It's absolutely. Anybody is welcome there at any time. Our current hours of operation are from 10 o'clock in the morning until 4 o'clock in the afternoon, Monday through Friday. We have some snacks, we have soup, we have drinks available for the individuals. We have mental health and SUD clinicians there and available. We have peers that are there available to meet the individuals. Nothing inside of there, whether it's the nutrition, whether it's the soups, the beverages, any of the services that we provide, from the classes to recovery circles, to the NA meetings, to the AA meetings. There is absolutely no cost to any of the participants to come there and be able to take advantage of that.
That's excellent. Where's the funding coming from?
The funding so far to be able to stand up and get the facility open, myself and my partner funded 100% of it, to be perfectly honest with you. We've seen a need, we've seen a gap here in the community that was not currently being filled. We opened the doors. We've been doing some fundraising to be able to bring in some money. We're hoping between that and some of the SUD and behavioral health services that we're going to be able to provide, that's where our funding is, to be honest, that's where our funding has come from.
You got the stage. We got an audience that's listening to Franklin County meetings, quite big one. Where would they send funds to if they would like to donate to your cafe?
Anyone, like I say, anyone is welcome at any time to stop by the cafe to
No,
take a tour.
is there an address to send a donation, is what I'm saying.
925 South Auburn Street in Kennewick, Washington.
Thank you.
99336.
Thank you, and thank you for doing that.
You're welcome. Thank you.
That's a leader right there. Thank you.
Right.
I was given this just about 2 weeks ago.
Okay.
And so would love to have you break it down for us, because
Yeah.
by itself, I have no idea what it means.
Yeah. So happy to talk through that. So the background or context of this was the question about when we were looking at cost sharing and what would be the potential funding for the facility based on a worst case scenario and a best case scenario. And so take that back and work through those scenarios and see what I can come up with. So I thought about that a bit and came up with a few different scenarios to try to better understand or share with the committee what a worst case or best case or even what break even might look like on this facility. And this is for all 4 of the units combined, and looking at each unit individually based on what the anticipated or expected operations might be. So an ENT might perform much better than the 23-hour observation, for example. We just don't know. So we estimated that a little bit lower, just to be a little bit more conservative, right? The crisis stabilization unit also is a little bit more difficult financially performance as well. So we estimated a little bit lower on that one also. And then, the ENTs and the recovery. Also, we used our current or similar information from current facilities that we're operating today to help come up with some of these estimates or guidelines, if you will. So occupancy is looking at the total number of beds or recliners that will have somebody in it throughout the course of a 24-hour period, right? And with that, the largest unit being the 23-hour observation, and that's being calculated on a per-hour basis. I had to take and recalculate all the 24-hour units, the 3 units, to an hourly basis, and then make sure that we have that common bottom denominator there. And so what I did is, based on that, maybe a 20% occupancy on that 23-hour observation. And, so that's really pulling that number down on the occupancy. And then the payer mix is saying, if there's somebody in there that has a pay source versus somebody that has no pay source at all, right? And so 75% of the people coming in has a pay source. And then the 25% ultimately didn't have a pay source in this particular scenario. And what that looks like is about $5.6 million loss from all 4 units with that. The break-even piece, occupancy at about 68%, so that's increasing the occupancy across all 4 units a little bit. The 23-hour observation, of course, that's a much higher occupancy as well. And then payer mix at about 90%. And then we're looking at about break-even on that. You can see it's about $20,000 for that particular scenario. And then the best case with the occupancy at 74% overall, payer mix at 92%. We're looking at about $1.4 million gain from operations. With that, just something about the payer mix, we're looking at the 90s, the 90 or so percent is something that we're currently experiencing in our operations today. So it's not unheard of to have a high number of pay sources aligned for clients as they present. So we are highly successful in finding a pay source ultimately for clients as they come in. So I know that's a lot to digest. What kind of questions?
That is immensely helpful to have some context with these numbers. So essentially right now, occupancy and payer mix, if either of those go up, it's helpful on an economy of scale for the center's viability.
Yeah.
And so the most critical one is the payer mix. The higher that we can get the payer mix, the more efficiently the the center can run with relationship to tax dollars from the
Yes.
community itself.
Yes.
That's really, really helpful to have some of that context. On the 23-hour unit, the goal would be that unit does poorly, so to speak, because that would indicate that our community is getting healthier, so to speak. So at first, when you said that 20% occupancy rate, I had to think about that a minute to kind of think through what that would mean. So that unit not being full is a good thing.
Yeah.
And the other ones, frankly, all of them not being full would be a good thing. However, the need is here, and it's critical in our community today. I'm really excited having this conversation today. This has been immensely helpful for me, and having this understanding of where we're at, what we're doing, and I have gained more knowledge in the last 2 weeks than I have in the last 2 years combined, and so this has been very helpful. So thank you for that. Would love to just kind of have a conversation, don't need to write anything down, but about some of those rates and so forth in that unit, and kind of what that cost is going to be to operate the facility. And I don't know what this looks like. I know that the facility in totality is in the range of 200,000 square feet, and the CVCR is roughly 55,000 square feet of that facility, so it's just over a quarter of it. What is operation and maintenance of the building, not counting payroll, going to entail?
So payroll is roughly, so when I talk about payroll, it's the cost of the salaries and the benefits, right? Full cost of an FTE. That's about 80% of the cost. Operational cost is about 20%. That includes the building maintenance, upkeep, as well as any supplies or, other things. Food is really probably the next biggest cost for these facilities outside of payroll. So it's about the 20% of the cost of the facilities is the operational side.
So my guess at $3 million was pretty close. Yeah, this has been really, really helpful to hear this, have these conversations, and have a more clear understanding. This is going to take some time for me to kind of think through in light of the letter that we received this morning. But just what would or could a contract between Franklin County and Comprehensive look like in relationship to Franklin County residents? I'm not sure. So just kind of what would the purpose and what would the framework look like for that? So that's something I just kind of need to think about. I haven't had that thought. That's all for now, Mr. Chairman. Thank you.
Any other further questions?
Just want to thank him for coming in today and answering questions and enlightening us. Thank you.
Yes.
Very, very helpful.
Appreciate the time. Thank you.
Thank you so much.
And I'd like to leave you all with, ever since the Recovery Coalition was formed, and for those of us that sit on the Bi-County Advisory Board, it has always been our full intent to have full transparency with all commissioners from both sides of the river, and to have this truly be a no wrong door facility for all residents on both sides. All of the meetings that we hold, the Bi-County Advisory Board meetings, there's time in those meetings for public comment. All of those meetings are fully recorded. Brian comes over to those meetings. He takes part in those meetings with questions. Even with all of that being said, if there's further questions, concerns, or you feel that there's lack of transparency and we need to hold a few more of these workshops, a few more meetings, a few more conversations need to be had, you guys feel free to reach out to me at any time. I'm more than willing to have more of these meetings because, again, we're fully committed to having a facility that helps both the residents of Benton and Franklin counties.
Thank you so much. Very appreciate all of you coming today and sharing with us.
Jason, if you have a card or after the meeting, I'd like to get your number, please.
Yep.
Thank you.
All right, thank you. Is there anyone in the room for public comment? Hearing none, is there any other business?
Oh, that's right.
All right. So at this point, we'll adjourn the meeting. Thank you.